Okay, so a lot's been going on. I know I haven't made a video in a little while, but basically they wanted to do the endoscopy to make sure that I didn't have a hiatal hernia and some other stuff. That was Friday. Today's Tuesday. And I found out that I had over 8 ounces of bile in my stomach from my intestines coming up, which is actually quite a lot. And if it goes untreated, it could possibly lead to esophageal cancer. So the recommendation is to do the gastric bypass now instead of just doing the sleeve. So I had my appointment yesterday with my neurologist, and she actually has had quite a few MS patients that have had the gastric bypass. She said they usually do better with the bypass than with the sleeve, just in her personal, experience with her patients. But she said she's had some that do well with the sleeve as well, but usually the ones with the bypass, it tends to help their MS a little bit. Not quite sure how or why. I also learned that I'm one of the few people, apparently, that the Avonex has not decreased, knock on wood, decreased my white blood cell counts like it does in most people. So my chances for infection are not increased. Normally, I guess apparently most people that are on it, their white blood cell counts go down, their immune system is compromised a little bit, and so they're at like something like 15% more increased rate for infections, and stuff like this. So at this point in time, the universe and everybody is just pointing to the fact that I need to do the gastric bypass. If I do this, of course, it'll bypass the possibility of the esophageal cancer and all that kind of stuff. So that's where it leads to. I was upset for quite a while, dealing with, I have MS, and now, oh my God, you're telling me this, and dealing with all that aspects, and of course doing some research and talking to my other specialists about it all. But I'm still on an emotional roller coaster because it's just a lot to take in. Sometimes you feel like, oh my God, I have enough shit wrong with me, and yet I'm going to add another thing. But my husband's been great. He's been really supportive and things of that nature. So, and the kids have been good, made sure to tell the boys first, then, the rest of the immediate family and stuff. So, it looks like I most likely would possibly have a surgery date in August. We're just waiting for that blue credential something or other. I'm not a nurse or a doctor, so I don't know all the technical terms necessarily. But they're waiting for the credential so that Blue Shield, my medical insurance will cover, like 98% of the insurance, or 98% of the surgery. And I was happy to find out that my copay wouldn't change based off of, the sleeve versus the bypass. So I am now going to be a gastric bypass patient instead of a sleeve patient. And they told me to stop dieting, to eat regular food up until the couple weeks, 2 or 3 weeks prior to, and to do the liquid diet and all that kind of stuff that I guess everybody has to do. I don't know where to put this stupid camera. So I don't know, but we've been remodeling the house. My husband and I talked about it. We're going to finish up the projects that we have, get everything situated, because I know that there's a potential with my MS that my old lesions, my old, what do they call them? My inflammations, the surgery may cause my old stuff to come back. So like my dizziness that, I get that reoccurs and that kind of stuff may come back for up to 2 weeks after surgery, any surgery as a matter of fact, because of the change in your body and the stress of it and that kind of stuff can cause that. So they just want me to monitor it very well. I'm doing really good. I'm stabilized with the Avonex. So it looks like I'm going to miss the shot after my surgery. So I'm going to skip one shot, but it's going to be after the surgery. Just to make sure that my body is healed enough and, it allows that time period. But I am going to take it like 3 or 4 days right before surgery so that it's in my system. And we're also upping my vitamin D so that I'm getting closer to 100 going into surgery. so that, because for the first couple of weeks it's going to be really hard, I guess, for me to get, you know, everything in and absorbed and that kind of stuff. So they want to make sure that I'm going in with high levels of everything, so that if it does drop down some, it'll be within a reasonable amount. And again, this is just my case, my doctors. I have like 6 specialists that I see. Everybody is different. Everybody's situation is different. But I was really relieved to find out the number of MS patients that my new neurologist, my MS doctor, has had go through this. And she's very confident in the doctor that's going to be doing my procedure. So all in all, I think everybody is communicating very well. They're being a team, which is super important to me. I want to make sure that all of my doctors are communicating with each other and they all know what's going on, so that nobody drops the ball on one issue, whether it's, you know, my thyroid issues, or whether it's my sleep apnea, or, you know, all these other things that is going on. So I know that one of my best friends, I should say, wanted me to do a video on my way to the hospital. However, things got delayed that day, so I didn't get a video done going into the procedure. And of course, afterwards, you would have just seen a big snot-nosed, you know, bawling person attempting to talk that couldn't talk. It's pretty devastating to find out that you have such an increased significant rate. And the odd thing about it was that, I don't remember the name of it, they said that it was the Michael Jackson drug that they had given me to do the upper GI, the endoscopy, endoscopic, however you pronounce it. Anyways, I had almost a migraine going into it. They sucked out, I don't know whether he said about 8 ounces or a little over 8 ounces of the bile out of my stomach. After coming out and being fully awake, for the first time in, I honestly can't remember how long, didn't have a headache. I did not have a headache for several hours. I had, of course, after all that, and I had calmed down enough to be able to eat, I ate and stuff like that. And I'm going to say probably within 45 minutes to an hour of eating, my headache immediately came back. And apparently the bile stuff can cause headaches. So at this point, I'm finding a lot of things out. I'm finding that my fatigue can also be caused because of the bile thing, which also, you know, the sleep apnea can affect it. So now it's a matter of going, okay, is this a side effect of MS, or is this a side effect of these other issues that I have? This procedure is supposed to help with, I would say, 3 out of the 4 major health things that I have. So in that aspect, it's going to be the win, I guess. I don't have very much to say else other than that. So that's where we're sitting at. See you guys later.